Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes with Valley Health. West Virginia, like many other states in the U.S., has seen a staggering rise in hepatitis C cases. Hepatitis C, a virus that can be deadly, and thousands of people don't even know they have it. So we're talking with Dr. Leonard White today about the prevalence of hepatitis C and how to identify it. What are some of the first signs? Since thousands don't know they have it, what are some of the first signs that there might be a problem?
Well, unfortunately, when someone contracts hepatitis C, it's a viral infection, and many times people don't even know that they have it. It's very usual for individuals to have it for some time and have no symptoms at all. However, when one does begin to have symptoms, usually they present with general fatigue, myalgia. If the disease progresses, you can have some abdominal pain, nausea, vomiting, and you also can see a discoloration in your skin, referred to as jaundice, and most likely the general fatigue is what brings individuals into the hospital or to the clinic to be evaluated.
Just that general, I just don't feel good anymore, and they can look into it. So with the rise of hepatitis C, what are some of the risk factors that contribute to people contracting it?
The major risk factor that we've seen is those individuals who are exposed to blood products. Before 1992, we really didn't have standard testing as far as transfusions are concerned. So we saw a rise in hepatitis C from individuals who received transfusion. But as of late, individuals who tend to have access to or use needles or share needles and share syringes. So those are IV drug users. That's where you mostly see, that's where the bigger issues with regard to hepatitis C is seen.
So how do we treat this, and what kind of treatments are available?
Well, unfortunately, we don't have any vaccines for hepatitis C, unlike the other hepatitis viruses, but we do have treatment. And treatment usually lasts between 8 to 12 weeks. And the goal with treatment is to see a zero rate of the viral replication within the system.
And how often does that happen? I mean, what's the success rate of these kind of treatments?
The success rate is very high. The biggest thing that we need to do is make sure individuals, when they do have the symptoms that we talked about, come in to be evaluated. We first obviously do a physical exam. After the examination, we do blood work. We check the liver enzymes. Sometimes we will get an ultrasound to see if there's any structural damage, and if the information that we receive from testing is inconclusive, sometimes a hepatologist will do like a biopsy and see if there's any damage there. And then based on the level of the disease, we can tailor a treatment plan.
It's kind of mind-blowing to think that in 8 to 10 weeks, most people would have this disappear and not have the complications from it.
It's very true. We've come up with some very innovative ways of treating it. Direct viral drugs have been established now, and like I said, within 12 weeks, you see near 100% cure rate.
Still, people are dying from hepatitis C. Is that because they're not seeking treatment?
It's a combination of things. Some individuals have a combination of hepatitis C with hepatitis A or B, and that makes the treatment a little bit more difficult. Also, if you have previous conditions, diabetes, high blood pressure, coronary artery disease, that makes that individuals a little bit more vulnerable to the disease. And as you mentioned, if you don't seek treatment, then the acute phase of hepatitis C can turn into what we refer to as chronic hepatitis C, and that's a little bit more difficult to treat.
All right, so seek treatment as early as possible. And there are a lot of resources out there to help you.
Absolutely. The Department of Health and Human Resources has a boatload of information with regard to individuals that are living with hepatitis C. And you should also check the CDC website, and it gives you a bunch of Q&As that can help you guide your way through this process and give you some helpful information.
Yeah, thousands of people affected by this, and we're just trying to touch the surface of this conversation, but we sure appreciate all of your advice on how to identify it and how successful treatment can be for hepatitis C. Dr. White, thank you so much for being here.
It was my pleasure.
Thanks for checking in for Monday Health Minutes.